Ginger? How are you doing today?
Good, thank you.
Good. And what are you here? Oh, go ahead and take a seat. What are you here for today?
Oh, just a routine physical, and I want to be tested for STDs.
Okay, well let me go ahead and ask you a couple of questions first.
Okay.
Can you tell me how old you are?
I'm 38.
And do you have any family?
Yes, I have 2 children, 2 girls, they're 14 and 16.
Okay. And what's your occupation?
I am a legal secretary.
And have you ever been married before?
Yes, we divorced about 5 years ago.
Okay. I'm going to go ahead and listen to you real quick, and then I'll get your blood, and you can be on your way today, okay?
Okay.
All right. And just listen to your heart. Okay? Oh. How about that open? All right, thank you very much.
Dr. Steve, can I help you?
Hi, Dr. Steve. This is your nurse, Ashley.
Hi, Nurse Ashley.
I'm just calling to talk to you about Ginger's blood tests. Her EAI test came back positive. Can you explain what this test is and what we need to do next?
An EIA test, that's an enzyme immunoassay, is done to detect the serum antibodies that bind to HIV antigens. If a patient reports recently risky behavior, encourage retest at 3 weeks, 6 weeks, and 3 months. The patient would require another EIA test. If this comes back positive, a Western blot test is done to confirm that antibodies are related to the HIV virus.
Well, what is a Western blot test?
About 0.2% of the EIA tests give a positive result that are then proven false by the Western blot test. The EIA test can be falsely positive for several reasons, including a patient's autoimmune disease, multiple pregnancies, blood transfusions, liver disease, hemodialysis, and vacations for hepatitis B, rabies, or influenza. Any of these conditions can stimulate the immune system to produce antibodies that cross-react with HIV antigens and produce a false positive. The Western blot test, it incubates serum samples with purified HIV agents that are electrophoresed, and if these antibodies are in the serum, it's present, it's going to be detected, and that's how we confirm it.
Okay, well, I'll call her in for a second EIA test in a couple of weeks, and then do a Western blot test as well. Thanks. Hello, Ginger. Hi, this is Ashley, the nurse from Dr. Steve's office. We just wanted to have you come back in on Wednesday at 2 o'clock for another lab test.
Is everything okay?
He just wants to confirm one of your blood tests, that's all. Okay, we'll see you then.
So the second EIA test came back positive, and so did the Western blot test, which this confirms that she has HIV. So we're going to go in there and give her the news that she has HIV.
Okay.
Right. Hi, Ginger. Contrary to popular belief, what happens in Vegas doesn't stay in Vegas, and I regret to inform that you have HIV.
Have you called anyone to come and get you? Okay, well, I'll wait here with you until they come and get you. Do you have any questions for me?
Why didn't I show any symptoms?
Many people don't experience any symptoms. Some people experience acute retroviral syndrome, which is associated with flu-like symptoms, such as fever, swollen glands, sore throat, rash, fatigue, muscle aches, and headaches. These symptoms can last anywhere from several weeks to a few days to several weeks. Each of these symptoms can be caused by other illnesses as well. Not everyone who is infected with HIV develops ARS. Many people who are infected with HIV don't even have symptoms for 10 years or more.
Hey Ginger, I'm here to take you home because you're in severe distress right now and you shouldn't be left alone after this bad news. It's okay, baby.
Now, when it comes to you and us, I have a few unanswered questions. So, before this tale of bloody revenge reaches its climax, I'm going to ask you some questions, and I want you to tell me the truth.
Nurse Ashley, it turns out that Shay is a hemophiliac. He is tested every 6 months for HIV. His last test was negative, but he was retested when I was diagnosed. He was positive. It turns out he got the HIV infection from recombinant factor 8.
Nurse Ashley, do I have a legal obligation to tell future sexual partners that I have HIV?
No, because we're getting married.
Well, many states and some other cities have partner notification laws, meaning that if you test positive for HIV, you and your healthcare provider may be legally obligated to tell your sexual partners or needle-sharing partners. In some states, if you are HIV positive and don't tell your partners, you can be charged with a crime. Some health departments require healthcare providers to report the name of your sex and needle-sharing partners if they know that information, even if you refuse to report that information yourself. In Oklahoma, it's a felony for any person after becoming infected with a venereal disease and before being cured by a physician in writing to marry any other person or to expose any other person by the act of copulation or sexual intercourse to such venereal disease or to liability to contract the venereal disease.
Okay.
花よきれいとおだてられ咲いてみせればすぐ散らされるバカなバカなバカな女の恨み